Good evening. My name is Sue Madewell, and I work as a physician assistant at the Dartmouth-Hitchcock-Keene Clinic. I also serve on the board of Cooper's Crossroads, which is a small nonprofit organization in Keene. Our mission is to raise awareness regarding adverse childhood experiences and trauma through education and programs. On September 1st, we hosted a panel discussion discussing the impact of COVID-19 on mental health at the Dartmouth-Hitchcock-Keene Clinic. We had a great set of panelists, including Dr. Christopher Mills, who is a psychiatrist at the Keene Clinic. We had Katrina Nugent, and she serves as the Prevention Education Program Director for MCVP. We had Eli Rivera, who's the Cheshire County Sheriff, and Phil Wyzik, who's the CEO of Monadnock Family Services. I would like to extend a thank you to the Center for Population Health at Cheshire Medical Center, who helped to support this event. And we had two ASL interpreters, both Karen Todd as well as Christine Burkalt. So again, this event occurred on September 1st, and we appreciate you tuning in to listen to this event. Thank you so much. So tonight, the topics that we'd like to cover, which I highlighted in the flyer that we've advertised, is how has the pandemic affected individual mental health? What are the challenges in meeting the needs of individuals? And what are ways to support mental health? And I wanted to start because this is something that is public information that's posted on the Center for Population Health website here in Keene, and it's the Greater Monadnock Community Survey of 2020. And so they compare by numbers. UNH does the surveys, and they compare numbers from 2017 statistically to 2020. And the key findings for mental health and community services are as states. 3/4 of residents say that they always or usually get the social and emotional support they need. However, 1/3 of residents say that their mental health wasn't good, and 5 or more of the past 30 days, representing a significant increase since 2017. Few residents feel the general public is very understanding of people with mental health problems, but a plurality believe the general public is somewhat understanding of them. 1 in 5 reported a time in the past 12 months where someone in the household needed or wanted medical care for a sickness or illness, or for a routine physical exam or checkup, but did not or could not get the care for any reason. When asked whether there were certain services unavailable or inadequate to meet the needs of the community, respondents were most likely to mention drug treatment, mental health counseling for adults, alcohol treatment, and mental health counseling for youth. And when I read this, I actually, I felt like this was a comparison of 2017, to 2020, and the pandemic started in 2020. And this dramatic increase that they say was significant, I think really reflects the stress that occurred for community members. And I also thought, well, the community members are also starting to recognize that we need more mental health services to support our community. And I thought it was a plus. We talked about this. 30 years ago, I don't think people would be mentioning that we need more services for mental health. I think there was a stigma, and we're starting to break that stigma about bringing forth issues related to mental health and actually talking about them in the public. I mean, this is not providers or people that are working in service-related industries associated with mental health. These are people out in the public saying, I think that we have some issues here. And I take it as a positive sign. So before we start the discussion, I really wanted to have Dr. Mills talk a little bit about the stress response and the impact on mental health, in particular during this pandemic. And I think it's important just to be mindful of the content of information that he's going to share with us as each of the panelists start to answer their questions and we have open discussion about it.
Sure. Well, I want to thank you, Sue, for putting this together.
Oh, you're welcome. Thank you.
This is pretty remarkable, and I appreciate your hard efforts. So the stress response and the impact of trauma is it's a complicated issue, but throughout our lives, from childhood and throughout the likelihood of us experiencing some sort of stress or trauma is always there, and it can be physical, it could be emotional, it could be a one-time event, it could be multiple events, it could be a recurring kind of process where it happens over and over again. And it affects our bodies and our minds in a sort of a set pattern. First, generally our brains perceive danger or some kind of threat, and then we going to produce a stress hormone response. It's a stress response. It produce cortisol from our adrenal glands. That cortisol then has sort of far-reaching impacts on all sorts of body systems that set in motion what's essentially the fight or flight response that helps us prepare for that danger or help escape it. And when it's an emotional trauma, it's a little bit different sometimes, because then it has the ability to create memories, and those memories can then be re-triggered at a later time by anything that causes a sort of a flashback or a dream, if you're sleeping, of that event. And the stress response that you then get can be just as impactful, just as large or worse than the initial event. And you can get a recurring pattern of this going on that impacts your life day to day, and that's sort of the basis of post-traumatic stress disorder. And that has all sorts of far-reaching impacts. You can have avoidance. Behaviorally, you can avoid places and people where you might perceive that type of threat. You can have a state of hypervigilance where you're constantly on edge, worried about what could happen next. It can impact your sleep, your relationships, all sorts of things. We've known, with a greater understanding of how trauma impacts us, we're also starting to see what kinds of things can cause those problems. And childhood experiences particularly can set in motion this sort of long-range impact for the rest of our lives sometimes, particularly children who might witness or experience violence in the household or abuse, or if they might lose a loved one to suicide or natural causes or otherwise, or if they lose a parent because they were taken away because of incarceration, or if substance use is in the house. All of these things can really, we're starting to see impact us for the rest of our lives. And you can actually have these adverse childhood experiences or really any trauma set in motion this stress response in a sort of a chronic fashion where your cortisol levels are chronically elevated. And when you get into that situation, you've got adverse effects on your health, you can get coronary disease, you can get impacts on your behavior, certainly your relationships. Weight gain can be a consequence because cortisol increases appetite. So things that are far-reaching beyond what might have happened years ago continue to play out and create adverse consequences years later. And the pandemic, has just made matters worse in some cases, because the emotional support and the connection that we have sometimes with people helps alleviate some of that stress. And by social distancing leading to social isolating, some of that is removed, and we become a sort of a much more lonely environment. So the pandemic, I think, has made, for some people, matters much worse. We're also, learning more and more about how to take care of people who have experienced traumatic events, but it's really just starting. All too often, people who are suffering from the impact of past traumatic experiences go out into the community, to their jobs, to their businesses, to the doctors even, and they may find that matters get made even worse. You can imagine someone who was subject to abuse as a child, and they're struggling with it still as an adult, and they want to go talk to their doctor about it, and they get to their doctor's office, and the doctor takes the stance of, well, I'm the doctor, you're the patient, we're going to do things my way. Well, that kind of approach is absolutely, going to backfire here. This is exactly the kind of thing that this person was experiencing as a child. Here it is now playing itself out again. So we're starting to learn how to become more sensitive to and understanding of what's going on under the surface, even though, you may not see it just when you interact with people day to day. We're also starting to see, thankfully, how we can kind of treat the stress response and lower cortisol levels and try to use some techniques to help people who are experiencing chronic stress response. There's a doctor in Boston and Harvard, Dr. Benson, who's spent a lot of time on this, basically relaxation response, which is the polar opposite to stress response, but essentially through specific breathing exercises and visualization and focus exercises, meditation, things that can help reduce cortisol levels overall and counteract the stress response. Physical activity, yoga, walking, Tai Chi, all of these things can help lower your cortisol level. And just, social support from your coworkers and your loved ones, your family members and friends, all of this can help to reduce cortisol levels and treat the chronic stress response. But so much more to do still.
Great. Thank you for that information. Does anybody on the panel have anything to add about the stress response at this point?
Well, I would just add, Chris, I think you summed it up very, very nicely, but I think the notion is that the stress response is a natural process in our bodies, right? And we're hardwired to do that, and that's an adaptive thing, right? We have to jump out of the way of our oncoming car, right? We need that burst of cortisol. But it's never designed to be a chronic thing, an ongoing, 100% all day long thing that really does the body damage. Unfortunately, we live in times where we're all under this sort of chronic pressure, which makes it a health risk, clearly.
Absolutely. Yeah, it's built into the system for a good reason. I mean, it kept us out of danger when we were, needing to be safe. So it's got its purpose, and yet it can become maladaptive when it starts to come back over and over again inappropriately.
Okay, thank you.
And I just wanted to say thank you too for, having this discussion and bringing this up. I think for us, at MCVP as an organization, we've been talking about trauma that we've been seeing in our clients for years. And it's awesome that we have more people joining this conversation.
Mm-hmm.
So thank you.
Thank you. So the first question that I had available is, how has the pandemic affected individuals and mental health? And I have to say that when we first went into lockdown as an associate provider here, we had a lot of downtime. And of course, I resorted to social media and did a lot of reading. And so there was a lot of articles written in the New York Times, the Washington Post, and the Boston Globe. So these are Eastern Board. And they were really reflecting in these major metropolitan areas that there was a really high level of domestic violence, or a higher incidence of domestic violence being recorded. And in the back of my mind, serving on the board of Cooper's Crossroads, I always thought, well, I wonder what happened in Cheshire County, what's happening with our public sector here. And when we decided to try to have this panel discussion, the first thing I wanted to do was really to find out numbers in Cheshire County. And how did it affect, our members of our public? And so I reached out to Sheriff Eli initially, and I just asked him a couple of questions on the phone, aside from asking him to be on the panel, which I totally appreciate, obviously. So I asked them to check to see if between 2019 and 2020, if they noticed any upticks in domestic violence, alcohol, substance misuse, suicide and mental health related checks, and welfare checks for children. So I just kept it to 4 things at that point. And he said, sure, I'll meet you and I'll take a look at the numbers. So we met and talked a little bit, and I was really kind of surprised because when he met with me, he said statistically he saw no significance between 2019 and 2020. Oh, that's not supposed to happen. Sorry, I have an alarm clock to keep track of time. So I was surprised by that, and I went further because we had a discussion, maybe I should go to some local police departments just to see what they're also reporting. So I corresponded with the Chief of Police, Stephen Russo, here at the Keene Police Department, and I also had a conversation and met with Lieutenant Evans. She's at the Hinsdale Police Department. And so the Keene Police Department was able to statistically give me their calendar of March of 2019 to 2020, and then break it down because the lockdown actually started in March, and then from March 2020 to 2021. And Hinsdale was actually just the calendar year, so it was 2019 and 2020. So in Keene, the assaults went down, and in Hinsdale, there was a slight increase. For the Keene Police, in terms of domestic violence, those numbers went down. And that was the same case with Hinsdale, which they were comparable to 2018 numbers. With regards to substance and alcohol misuse in Keene, they were down, those numbers, and they were similar in Hinsdale. For suicide attempts and threats, there was a slight increase in Keene. For suicide attempts and threats, they were slightly down in Hinsdale. For suicide and mental health checks, they were slightly down in Keene, and for welfare checks, they were similar to 2018 in Hinsdale. In Keene, there is an uptick of disturbance calls, and in Hinsdale, they remain similar to 2018. And then in Hinsdale, they did report that the sex offenses for children in particular in 2020 did go up a little bit. So my questions for Sheriff Eli, please explain what a call for disturbance means, and what is your take on these numbers and what you've discovered in surrounding towns in Cheshire County during the pandemic? And then I have another question for you after that.
Thank you, and thank you for having me here.
You're welcome.
It's a
Thank you.
pleasure to be here. A disturbance call for us, it depends on what the person who's calling into the police department observes. It can be anything from 2 people having a loud argument and they believe that something might be wrong. It can be a large party at your home and some of the neighbors think, hey, something's going on at my neighbor's house, they're being loud, there's bottles being broken or whatever. Or it can be nothing, somebody might think that something's going on at a parking lot or wherever, and the police will arrive and kind of look into it and see whether there is or there isn't any wrongdoing. And for the most part, just go about. But the disturbance is a wide category of what it could be. Depends on what the person calling is. And when we spoke earlier about the numbers, and I did that research for you, we didn't notice any drastic changes in our numbers for domestic or alcohol or calls for several reasons. And I think it had to do because people were not going out. So if they were drinking or they were having issues, they weren't doing it at home. Domestics, one of the reasons that we thought maybe we're not getting any reports of domestic because now everybody's at home. The abuser might be home preventing the person from calling. Another thing that we noticed were any child abuse cases, that maybe a school will report were not being reported because now the schools didn't have that contact with the kids. So there was all these factors that came about with COVID that kind of made everyone change the way they were doing their jobs. the household, all of a sudden now you have a family that was, both parents were working, the 3 kids were going to school. Now all 5 are at home all day because either the father lost their job, or they had to stay home to teach the kids. They don't have any child care. So now we have 5 people at home all day, 24/7. You can imagine. And it turns out to be that the stresses of not working, the stresses of COVID, the kids not going to school, now I'm a teacher, I'm a librarian, I'm doing everything at home, can really impact that family environment. So in some of the conversations that I've had, we felt that there might be a decline because now they're not reporting it because of those, they don't have an opportunity to report it because the abuser might be home with them all the time, or people from the outside are not witnessing it. So that's one of the things that we noticed that were probably some of the prevention that with the numbers. The other thing that we were concerned during COVID was who is watching these kids when the parents do have to go to work because of their jobs. Some jobs, they never close. The sheriff's office never closed. The dispatch center never closed. So parents had to improvise, who's gonna teach my kid, who's gonna watch my kids while I go to school. Hey, Billy, can you watch the kids and teach them school because my child care is not available? So the concern was, who are these folks watching kids? Have the parents had the opportunity to vet these kids? And there's any potential of some sort of child abuse going on that we're not knowing. So that was some of the concerns that we had, and the governor, through his funding, did allocate money to the law enforcement to help kind of put that as a priority. We know kids are home now. We need to make sure they're being safe, make sure that we go out and follow up any investigations that we get about potential child abuse, because now there's that potential of more contact. So with that being said, the remote learning, just threw a different curveball at everyone. Trying to improvise, trying to make it work, that those stressors, they kind of, because they will not be able to go out, they will not be able to separate for a little while, kind of kept it under the covers for a while, and now we're starting to see some of those reports start to come in of abuse that happened months and months or even a year ago. And they were afraid to report it because the abuser was at the home. Or now the kids are going to school and
The teachers.
they might start to talk. So
Thank you. Does anybody else have any points on this? Because this is a great segue for Katrina, quite truthfully, but I don't know if anybody else has anything to add before we do that. No? Okay. So my next panelist I was going to ask questions is Katrina, and I wanted you to speak on behalf of MCVP and give us a brief description of the services that you provide in Cheshire County. And I sat down with Katrina and Robin Christopherson, who's the executive director. And again, I was astounded too, because I thought, well, the numbers naturally probably increased during it, and the reporting was quite the opposite and similar to what you found in your numbers, Eli. So I wanted you to kind of go through the discussion that you had with me, because I think it's really important for our community to understand about the reporting. So thank you.
Yes, thank you. Yeah, so at MCVP, we are the local crisis center for all of Cheshire County and 14 towns in western Hillsborough County. So what that means when I say crisis center is that we are a part of this larger network of places that provide intervention services and prevention work for anyone who's experienced dating or domestic violence, sexual violence, stalking, child abuse, or sex trafficking. And so we fall under the umbrella of the New Hampshire Coalition Against Domestic and Sexual Violence, and we follow their standards and programs to run the work that we do. So all of our services are confidential, and what we have been finding, we also expected that we would have the sort of avalanche of reporting. Many of our clients do not have police involvement in their situations, and so what we normally see is a lot of our clients are too afraid to go to police. If there is police involvement, it's because a neighbor has called or a family friend has called. And so there are a couple things that happened when we absolutely, you know, our numbers sort of matched, that we didn't have this avalanche at first. So for like the first 9 months or so, we really saw a dramatic decrease in our reports that we were getting, in our calls that we were getting on our crisis line, and even referrals from family friends. So a couple of things that happen are exactly, you know, what Sheriff Eli said, is that people are home all day with these people that are, you know, displaying these abusive behaviors toward them, and so they're afraid. They have no opportunity. And with people being locked at home and not going to work, now they don't have that lunch break to come to our office and fill out a protective order. They don't have, you know, those half-hour window to, you know, call our office in between dropping off the kids and picking up the kids. So all of their opportunity to report really went away. It really went away. And that is for, you know, we do serve teens as well, and that was absolutely true for them. You know, definitely. We were no longer in schools doing our prevention work, and so the disclosures that I would normally get on, you know, at least a weekly basis, were not happening anymore either. So, you know, people just had no opportunity. And then the other side of that is the way that our community is laid out. I mean, it's very rural. You don't have people living on top of each other like you would in a metropolitan area. And so you don't have neighbors frequently calling, you know, I hear something going on over here, because they're too far away. You know, and then the other part of that is just access in general. If people don't have a car, or the person displaying abusive behavior to them is the only one with access to the car, now they can't come to us either. So really what we saw is the dramatic effect of, you know, the lack of resources that we have being a rural community. You know, there is no transportation, there is, you know, not a lot of mental health or other outlets for people to get the help that they need. And then the other side of it too is that when we do have people who experience, you know, chronic abuse, whether they're children or adults, is this level of accommodation that happens, which is typically really misunderstood for the general public. But they just sort of maintain, and they try to appease the person that is causing harm to them in order to stay safe. It's a survival technique, for sure. And so we see that over the holiday season typically, every year. And so I think that is also kind of what we were seeing during this pandemic as well.
Are you seeing now that people are more back into the workforce and things like that, like what Sheriff Eli had mentioned, that there is more of an uptick of reporting and things like that?
Absolutely, absolutely, yeah, for sure. I mean, and across the board. So we do have a family violence prevention specialist program that works in tandem with DCYF. We certainly have seen so many more reports of child abuse, and certainly a lot more people coming to us. I mean, we're already almost up to where we would be in a normal year for numbers of clients that we've served, just in these last few months, you know, that people have been back to work. So, yeah.
Okay. Anybody else have anything to add before I move on to Phil? Thank you, Katrina. So Phil has a big hat, because Monadnock Family Services is really a big organization, you know, serving Cheshire County. And I wanted to ask you to speak on behalf of the mental health services provided, and I wanted to get your opinion on how you think the pandemic affected individual mental health and why during this time period.
Yeah, thank you, Sue. Thank you for organizing the panel and for inviting me. And before I answer the second question, I just wanted to make a comment about, so what were things like before the pandemic ever happened, right? When it came time for mental health or for health reasons. And first thing I think people need to understand is that health is on a continuum, right? It's a range of health. There's a range of illness. You might have, people being really healthy and thriving, and people being more and more ill and disabled and at the end of their life. So it's on a continuum, right? And mental health is the same thing, right? It's on a continuum. It's not it's a spectrum of struggles vis-a-vis our, mental health. So before the pandemic hit, what were the causes that would would move someone down towards illness and disability? What was that like, And so obviously one thing we know is that sometimes there's a genetic component to someone's health conditions, right? Depression, for example, bipolar illness may have nothing to do with what's going on outside you, but there's some internal sort of time bomb that goes off that we don't quite understand yet. There may be things out of our control based on our biology and our genetics. Let's put that aside for a minute. But what other things outside us can help move us down towards illness, right? And as Chris said earlier, a lot of it has to do with stress, but let's unpack that a little bit. Because for some people, the stress that we're talking about is loss, right? A loss of a job, a loss of relationships, a loss of something that you held constant in your life, like social structure or a routine, going to the gymnasium, for example, for exercise. So one of the things that threatens our mental health is loss and how we cope with that. Sometimes it's not so much loss, but it's something called the social determinants of health, right? If we're worried about the loss of our house, worried about the loss of our, home because of economics or whatever, but the chronic threat of homelessness is a determinant that can make us less mentally healthy than if we don't have that stressor, right? Not to mention the fact that, as Chris said, sometimes that loss is trauma, but not just about trauma of violence, but it could be the trauma of racism. It could be the trauma of chronic poverty. It could be all kinds of things that produce this constant gnawing of our wellness so that it pushes us down towards illness, right? And now we're coming to realize that one of those losses and stressors is things like loneliness and alienation. That is even more potent factor in making us less mentally well than we would be otherwise. And there are even Cigna is one of the insurance companies that is really studying this because they speculate that loneliness is the equivalent of cigarette smoke in terms of their threat to health. There's some new literature out there that even says boredom is a threat to someone's mental wellness, right? So those kinds of stressors, if you add them all up, are things that can contribute to making us less mentally well. So now let's, on that, throw the pandemic in. And all those things are present in the world we live in these days, right? The uncertainty, the loneliness, the disruption, the extra burdens about worries, anxieties. So the pandemic just put gasoline on all those things and potentiate those stressors. So of course it's going to have an impact on how we all think about ourselves and the way we work in the world and our relationships. It's just ripe for problems that we may never have experienced before. So, early on in the pandemic, I remember back in March of 2020 and April, I would get all kinds of calls from the newspapers or radio stations or whoever wanting to know what's going to be the impact of this on mental health. To which I said, I don't know, but it's going to be big. Because there's no way that such a national, worldwide threat to health, even a physical one, is not going to have a mental health consequence. What's the causes of it? Well, the constant worries that we all experienced about what's going to the next day bring. Where am I going to get my kids to school? Am I going to lose my job? When is my church going to open up again? The constant worry. Everything in the news was we couldn't control the virus. Hospitals were being overwhelmed. There was conflict about whether this is all hocus pocus. You couldn't trust it. Nobody was trusting the CDC, and there's all this conflict besides what the science was. And so we were filled with this sort of barrage of media and things like that, that also was a stressor and wore people down. So is the COVID pandemic a physical health problem? Sure it is, and we're not even through that yet. Is it a mental health problem? You betcha, and we're all dealing with it as well. So, I think it's commendable that Cooper's Crossroads and others have a forum like this to see how one's mental wellness is affected by all kinds of things, and we should talk about that and learn more about that. So I think it's commendable. And I can tell you that at Monadnock Family Services, we saw that early on in a rise of people looking for emergency mental health services. We run the 24/7 crisis service that's available to everyone in the region 365 days a year. We work with the Cheshire Medical Center emergency room to assess and support people with, psychiatric emergencies. And we saw an uptick in volume in the daytime, in the second shift, and through the night time. And that's peaked and valleyed depending on, I'm not sure what are the causes of it, but it's not spiking up continually, but there's been a sort of roller coaster, but definitely an uptick. So I think people we saw early on were hurting from a mental wellness point of view and reached out for help, which is good.
Great.
So I guess I would say it's clear that the stress of this COVID pandemic is affecting people's mental health every bit as it's becoming a threat to our physical health.
Thank you.
I would echo everything you said, Phil, and I listening to you, it brings up some pretty painful memories. I don't even like to think back on what it was like a year and a half ago, but I remember going into the supermarket and seeing the shelves empty and wondering, what's going to happen if I can't get food for my family? Should I stockpile water? What's going to happen if this thing spreads and the police get compromised or emergency services get compromised? There's all sorts of, say they're irrational now maybe, but at the time it seemed like anything was possible. There was a tremendous amount of fear, and on top of that it was the fear of loss. What if your loved one gets sick or God forbid dies? And it was happening to so many people. So yeah, tremendous stress, the physical threat of the virus, but the impact that it had on all of us mentally and continues to have, I don't think we're going to know for years. I mean, this is going to have the effect on our kids of missing out on school and social growth. It's
Yeah, I think that's a good point, Chris. The long-term effects of this, well, they'll be studying that for many, many years to come, because we're not at the end of it yet. And those stressors, to some degree, are still there, not maybe as salient as they were a year or so ago, but they're there nonetheless. And hopefully we can eventually get on the downward end of this crisis. But in the meantime, we're still dealing with it.
And sadly, in the midst of all of this, there's cropped up this enormous divisiveness in the country. Instead of pulling together in some ways, we've polarized, which is just going in the opposite direction.
I couldn't agree more, and I think we were polarized even before the pandemic hit, and that just, again, put fuel on that division, and whether it would be, political or sectarian or religious divisions, we were moving in that direction anyway, and this just pushed us even further apart. The opposite of what it does to make for a mentally healthy society. Frankly.
Exactly.
Well, it's not only the impact on the community and the mental health of the community, is the impact itself on the providers and public safety and people who are providing services to the folks that are needing it. The doctors, the EMTs, the staff at the ER. They're also being impacted because of what's going on. My staff, it's like, do we vaccinate? Do we don't vaccinate? How do we pull a car over? Do we not pull a car over? What do you want us to do, Sheriff? Are we locked down? Do I have enough PPE for my folks? So that in itself, created another layer of, stressors with everyone around about the safety of not just the community, but the safety of our staff and the people that are working under me and work for me, and when we take them when they go to the ED, you know, that staff there, the ambulance transporting, so it's bigger than just the community. It's everyone within the community, even the support staff and the staff, because, you know, the hospital had to make these arrangements to make sure that they were safe in-house, but they still had to provide services to the community. Same with us, you know, same with Phil, and we all had to adjust to that. So that in itself, you know, it does take a toll on our you know, on the decision making. Okay, how do we handle this? How do we move forward? How do we stay safe? How do we keep ourselves safe? You know, so.
I think you know, when it comes to reporting and complaints of various sort of issues, you know, I remember before the pandemic, there were all sorts of things I was passionate about. You know, we'd be passionate about going to a school board meeting, or about this legislation or that. When the world turned upside down, it's as if all of those other things paled in comparison. And so what you actually wanted to raise your voice about, sort of comparatively, was different now. Now, if you were going to speak out about something, it had to raise to an even higher level. And I'm wondering if, you know, because we were all sort of not wanting to engage with other people, there was also a reluctance to call for help, maybe, because you didn't want to get other people involved. Every other personal contact seemed like a possible risk to yourself, you know. We didn't have any work done. We didn't have anybody come to the house. We put all that off, and so it's possible that this reluctance to engage with everyone else was also a cause for lower reporting rates.
Yeah, and I think, you know, for us too, it was, so we provide emergency shelter for people, but our shelter is a communal living facility, and so we had to shut it down. You know, we couldn't take anybody new into shelter. And then eventually there was, you know, this sort of mandate that came from the governor's office and some extra funds that were provided, but we had to find hotel rooms that would take people, you know, in those types of situations. And, you know, what would happen if they were COVID positive, and now we have to put them in a hotel situation. And so there were so many other precautions that we had to take into consideration just to shelter people. And the extra money that we got went so quickly, you know, I mean, because we're paying, you know, for them to stay in a hotel instead of, you know, our own facility. And then, you know, once things started opening back up again too, those hotel rooms became more and more scarce, and we still couldn't bring anybody, you know, into our shelter, you know, for the risk of COVID. So it was very, very stressful for us. We really felt like we were failing our clients for a long time. And so, yeah, I mean, just the stress on us too. And the referrals that we make to like home visiting, you know, type of agencies and things, were certainly obviously less for a long time as well. So it was a big stress.
Thank you. So we're going to switch over to Dr. Mills, and I wanted to point out Dr. Mills previously, before he came to the clinic, worked for 3 years in a local substance and alcohol misuse facility. And so he's had 3 years of experience here in Cheshire County. And in the Keene Sentinel on July 15th, there was an article published titled 2020 Drug Overdoses Soared to a Record 93,000. And then verbatim, the increase came as no surprise to addiction specialists, drug counselors, and policy experts who have watched the steady rise in deaths throughout the pandemic. And I also put in Vermont, deaths rose by 57.6%. New Hampshire was one of the only 2 states in which drug fatalities dropped between 2019 and 2020 by 2 deaths. And then about 5 or 6 days later, the Keene Sentinel published another article, and it was titled Though fatal ODs aren't spiking, drug use still widespread in the Granite State. And they interviewed Sam Lake, and he's the executive director of the Serenity House, which is also affiliated with the Doorway. And I think what was good about that article is that he was saying, no, we still definitely have a major problem here. But because we have been really good in distributing naloxone, which counters the effect of a drug overdose, we haven't been seeing the fatalities that we may normally see in our area in Cheshire County. So I wanted Dr. Mills to kind of address how he thought the impact of the pandemic for individuals who are actively using, and what the impact is for people who are both in recovery or still have issues with substance or alcohol use disorders.
Yeah, well, it was significant in many ways. Two ways in particular were on the impact on the people in terms of the quantity of misuse and the quality of the treatment that they were getting. You know, I mean, it's no secret that the field of substance use disorders is frequently mixed in with mental health disorders. We find depression, anxiety, and trauma throughout the community of people who are having problems with alcohol and substances and prescription medications. And so with the pandemic, anxiety, depression, effects of trauma all increase. The fear of uncertainty, the social isolation, the fear of infection and loss of loved ones, all led to increases in alcohol use quite a bit, and opioid use and prescription meds. It was just across the board. And I'm afraid that a lot of people who were in recovery slipped and relapsed during the pandemic because it was one possible way to self-medicate for the enormous increased stress that people were experiencing. To make matters worse, you know, I was working in 2 residential facilities where we had to struggle with, could we safely stay open? And could we safely test people, and what if we came back with positives, and how could we quarantine, and enormous logistical challenges to kind of keep those facilities up and running. And at the same time, staff for those facilities were frequently either having to leave or choosing to leave, and there was a huge turnover, and so that impacted the continuity of care for the patients in terms of who their counselors might be. Many of the visits went to telehealth, so there was no longer that in-person kind of visit that frequently is more helpful, but in the realities of the pandemic, we had to move to telehealth, and so that was a less than adequate solution in many cases. So it was across the board, and I'm afraid that despite New Hampshire staying relatively flat in terms of overdose deaths, I think there's many more factors behind the scenes that would tell a different story if we really dug into the data.
Okay, thank you. I'm surprised because we have three topics of discussion, and we're almost at the bottom of the hour. So do you have anything else to add? Because I was going to try to move on, or are you okay?
Oh,
Yep.
yeah.
Okay,
yeah.
great. So the second point that we wanted to talk about during this discussion was the challenges in meeting the needs of individuals. And Katrina jumped the gun, and so she answered one of the questions that I asked about you know, were there access issues with the services that you're providing, and you did a great job explaining the concerns that you had, not only as the people providing the services, but also the difficulty for having or providing access for individuals needing a safe place. So thank you for allowing us to know that. And my concern, I thought, well, with the stress response, one thing that happens is with prolonged stress, we get a dysregulated stress, response, and so it can kind of shut down our frontal lobe a little bit. And that's our seat of executive function, and so if that's kind of shut down a little bit, you can have more impulsive behaviors, erratic behaviors and things like that. And so I wanted to ask Eli if they had noticed like an uptick of, like more erratic behaviors during routine stops, or there were more aggression and things like that. I've had personal people that I know that are police officers say yes, they feel like during the pandemic there's been a higher level of aggression and a sort of behavior. So can you speak to that?
Sure. I think it's more around frustration,
Mm-hmm.
dealing with the pandemic. And like I mentioned earlier, it's impacted everyone. So whether, we pull somebody over and they don't want to open the window because they don't want to get exposed to COVID, or is the officer doesn't want to get too close because they don't want, I want you to put your license in this little baggie so that I can, so, it can, we had to become creative on how to deal with some of the situations that we went to. But I think the frustration of the COVID, the anxiety of whether he's not wearing a mask and he won't, and he's right next to me, that can send somebody in a spin, and they can get agitated over that. Are they agitated because of the situation? Because, hey, and I don't want to leave, they should leave, they're not. So we get some of those scenarios where, that frustration might lead to, well, how do I handle the situation? And then on top of that, how do we deal with COVID? So that kind of threw a little twist. The officers around Cheshire County and throughout the state, we've had conversations about this. They try to be compassionate about when they deal with the folks, because they themselves have to adjust to it. I understand. I had to do the same thing. Either my spouse had to stay home so that she can watch the kids. I know what you're talking about. I have to wear this mask all day to work. So they try to bring some of their understanding into these conversations to kind of bring the person back to a level of understanding and compassion, but at the same time we need to deal with the situation.
Mm-hmm.
And like I mentioned earlier, some of these concerns about domestic and substance abuse or misuse, they, because of the isolation, we kind of got separated a little bit because we were not getting the calls, or we were not seeing the behavior on the streets, because people, you during the peak, you drove around downtown or drove around anywhere, there's nobody walking the street. So we were not observing a lot of these interactions and disturbances that we might typically watch in a nice summer night. So when the officers dealt with these situations, we talk about the escalation and how to deal with folks that are frustrated, angry, upset. When you throw in, we understand because we're part of it, I think it brings another level of compassion and understanding to the issue. So,
Thank you. So then with Phil, I just wanted to ask a question about how did the pandemic affect the ability to have therapy sessions and group therapy sessions?
Well, I think it's safe to say that our challenges about this delivery, the kind of healthcare we deliver, mental health care, were the same as any other provider, right? We had to readjust from, in a big way, of how we would deliver care, because it's traditionally a face-to-face kind of experience. And if you couldn't do that, then you really had to figure out some new solution to delivering that level of service. But that's true of doctors and dentists and everybody that's involved in healthcare. so things like telehealth became the new tool, right? And social distancing and moving chairs out of waiting rooms and trying to redo schedules. And so we did as much as we can to practically, kind of address the needs of the situation. And fortunately, the system that we worked in adjusted as well to make some of that stuff possible. So as you recall, back in March or April, you couldn't find a laptop to save your life or a video camera. There was a shortage of everything, right? And somehow we all survived that, and the supply chain worked. But so we had challenges just like any other healthcare provider. But more importantly, I think it's important to talk about how were those challenges met, because that's another side of the pandemic we really haven't talked about yet. Because in some instances, we saw the beautiful, wonderful human spirit at work that stepped in to fill the gap, right? There are many examples of how the community celebrated everyday heroes that we maybe gave not much thought to. People that worked in grocery stores, letter carriers, not only the first responders who are doing that every day, but people that you really didn't acknowledge in some way before were the people keeping society going. And we celebrated them and kind of were sort of more appreciative of their service to the community than ever before. So that's what was a way the challenge was sort of, we tried to address the challenge as a society. We also, I think, saw people stepping up to do, to help in some way, whether it was donating money or donating food. At one point, a local church called me up and said, how can we help your clients? Because we know they're probably struggling. I don't know what we can do. And so it's one thing led to another. They said, well, our congregation will have a food drive. And in the middle of a freezing April Saturday, their congregation showed up with carloads of food for some of our poor clients. Clothing drives, the community, in some aspects of the community, really wanted to help in some way because it was a community response. So I think that's, did we have challenges? Yeah, plenty. But we also saw a bright spot of human nature that stepped up to help and meet those challenges. So that was kind of something I'll never forget.
Thanks for speaking to that type of solidarity, which is really important within a community. So thank you for pointing that out. We are at the bottom of the hour, and I was hoping, I don't know if anybody's written in any questions. No, okay, so we have no questions. So I think we can continue, if you don't mind, for another 10 minutes or so. I'm going to combine for ways to support mental health. I'm going to combine two questions with Dr. Mills about if you can speak on the importance of the impact of isolation and to the opposite of that connection, relating to mental health and how you think the pandemic has affected that. So.
Sure. Well, one of the things we've learned about in the world of substance use is that people generally self-medicate with whatever they have available. And it's not always substances, it could be any number of things. But what they found when they tried to understand what was driving a lot of that was the lack of human connection. And that when you provided somebody with access to emotional support through the people that were in their lives, a lot of that need to self-medicate kind of vanished because they had everything they needed then. And so, I learned when I was in my fellowship that you think the opposite of addiction is abstinence, but actually the opposite of addiction is connection. And I think that can be true in a lot of ways for mental health. I think that it's important to remember, especially in a time of isolation, social distancing taken to its sort of extreme was social isolation and loneliness. And I think that it's important that, especially in these times, that we are pulling together and, as Phil said, acknowledging people that we might not have acknowledged otherwise. I used to leave little thank you notes for my postal worker back because this was the only way we're getting information from the outside world, it seemed, and it was some semblance of normalcy still being brought to our lives. So, I was very thankful for our postal worker and the person that brought oil to you know, all of that. You take it for granted until you run the risk of losing it. And so connecting with people, expressing gratitude for the things that we might have at one time taken for granted, refostering connections that we might have let languish, and especially, you know, letting people know how much they mean to you when we might not otherwise say it. I think it's really goes a long way towards helping with mental health in general.
Thank you. And then for Phil, will be our last speaker. And if there is anybody out in the audience that does want to try to write in a question, feel free to do so. I wanted Phil to speak to the importance of self-care relating to mental health and modalities that we can do.
Yeah, I'm happy to just sort of say a few things about that. But, you know, I think the first thing to understand is that when we're thinking about mental health, right, we really have to think about how does the human brain work, right? Since that's the organ in the body that we're really talking about, right? So the question is, to preserve your mental health or support your mental health, what does the human brain need? And as Chris pointed out, one of the things we're wired to be is social animals. Connections are important to our human brain, right? So, and it doesn't take much to convince you of that. I think we're all important, you know, social creatures, but that's what we need to survive. But there are other things we can do to make sure that brain is as healthy as it possibly can be, right? And as Chris mentioned earlier, I think, you know, the notion of exercise is critical because that brings oxygen to your blood and your brain needs oxygen to function, right? It also is a stress reliever because you're not in front of the, you know, it's just good for the body, it's good for the brain, right? Similarly, the notion of altruism, as we talked about a few minutes ago, is more ways to make a connection, to get out of your own space and think about somebody else. Very powerful. Research bears this out, that people who do volunteer work, for example, tend to be healthier over long term than others. If you think about yourself only because you're locked down, that's a little bit, again, a threat to your health. So there's all kinds of ways that we know altruism helps people stay healthy. And you can certainly do that, whether it's giving money or volunteering or things like that. The human brain, we know, also needs sleep. And it needs that restful recharging that we sometimes take for granted and don't give ourselves enough time to do. But you probably know from experience that you're not at your best when you're sleep deprived. If you have a little baby at home, it's hard to think straight if you're up all night long. Or if your job is such that it disrupts your sleep pattern, you don't feel well. So things like that. Obviously, nutrition is also something that helps the brain keep functioning properly. So when you're under a lot of stress, it's time to think about broccoli than it is more than booze. Think broccoli more than booze, because that'll help your cognitive processing and emotional regulation be a lot more healthy. So we tend to do the opposite, right? We're under stress, we want to reach for the beer. Well, think about other ways that your brain might need nutrition as well. And I think people would say sort of one's mental climate should be, if you can, try to think about positives rather than negatives. The glass is not always half empty. It can be half full, depending on your perspective, right? So a positive perspective goes a long way in keeping stress at bay and your health in the right way. And for some people, that positive climate in the brain comes from spirituality and meditation and other sort of stress reducing practices, all very, very helpful. So there's many things we can do, pandemic or not, that helps us function in the optimal, with mental wellness is optimal.
Thank you. Have there been any questions? Okay, so I guess this concludes everything, and I really wanted to thank our panelists and our interpreters that have been providing sign language. I wanted to let people know that there are resources available. There is a website for newhampshire.gov. It's relating to COVID, and there is a drop-down bar there for mental health resources. And always remember, in terms of suicide and things like that, you can call 911. We also have the Samaritans, which is a crisis hotline here in the Monadnock region that serves them, and certainly 911 is always a good referral. I tried to list a few counseling services as well as substance and alcohol misuse disorder-related counseling services that are available in Keene, and I may miss some. I apologize, but I tried to have an accurate list. For mental health counseling, there's Antioch College, which I think sometimes we tend to forget about, but they're a great resource. We now have a psychiatrist here at Dartmouth, Hitchcock, and Keene, and he's hoping to expand the services here, which I'm very happy about. The Keene Psychotherapy Services, the Keene State College also has a wellness center, so they have their own counselors there. The MAPS Counseling Services, MCVP, Monadnock Family Services, Mountain Wellness Associates, New Approaches, Southwest Community Services, and as far as for the substance and alcohol disorders, Better Life Partners, Community Improvement Associates, The Doorway at Cheshire Medical Center, Gates Recovery Center, Groups Recover Together, Keene Metro Treatment Center, the Keene Serenity Center, Live Free Recovery Services, Reality Check, and I think I don't want to forget the 12-step programs that there are multiple 12-step programs within the community. I think this was a great venue, and I really appreciate everybody's time that you took to do this, and I hope that the public appreciates the time that you spent talking about the impacts on mental health related to the COVID-19 in Cheshire County. So thank you very much.
Thank you. for
Thank you.
having us.
Thank you.